about Dr. Lamonso. It's a pleasure to have you with us here at Senior Care on TV. I'm so thrilled to have you here with us. Not only are you a professional, a doctor of optometry, but you are also a senior citizen. I'm sure most of our viewers would appreciate that.
Yes, I'm 82 years old.
Oh, that's amazing! Isn't that amazing? And you are still very, active and
Luckily.
luckily. Well, are you still working? Talking about
Yes, I am. I'm still working.
okay.
Not full time,
How
but
many
still
days?
working. I work 3 days a week.
Oh, 3 days a week. That's amazing. And are you still able to drive? You go around?
Yes,
you
I
do-
drive. I go around.
Yes. Most seniors would, be able to identify with that. Yes, it's interesting. You've given us a topic, lectures on, eye care,
Yes, I have.
the importance of taking care of our eyes.
Yes.
Now, what are the signs to look for
When you get older or
when you
all the
get
time?
older? When you get older?
Okay. When you get older, there are really more signs than when you're younger. But the signs of whether you really have a problem coming is, number one, a shading or a diminish of your visual acuity. Number two, a narrowing or constriction of your visual fields. Number three, an impossibility to really focus your eye from far to near, although that's everybody. I'm trying to think what else. And if you have some specific diseases, systemic diseases, which will cause no symptoms in the beginning, but can cause disasters as time goes on.
So that leads me to this question: how often, for people that are over 60 or 65 years old, how often should they visit a doctor?
I'd say a minimum of once a year.
Once a year.
Mhm.
That's good, and they should watch out for the symptoms that you identified.
Well, many of these symptoms, many of these symptoms have no effect at all in the beginning.
Okay.
For instance, glaucoma has absolutely no symptoms when it begins. You don't know you have glaucoma until one of two things happen. Your vision is really so centralized that you can't see the walls or the sides, or you bump into things at night, things like that. Okay, or you have big gaps, holes in your vision, called scotomas. That's areas of your visual part of the retina, which has been destroyed by some either hemorrhage or exudate or something that actually destroys part of your retina, or even the retinal detachment.
Wow. Yeah. I came across a study on dry eye. That
Yes.
is very peculiar, to people as they age.
It's to almost everybody.
Really? Okay.
Yeah, what dry eye really is that in order for you to see clearly and feel comfortable, the cornea must be well supplied with tear fluid all the time, so that the cornea, the tissue of the cornea, which is the front and surface of your eye, the actual window through which light passes to get to the retina, becomes damaged, irritated. And this affects most people. The older they get, the more dry they becomes. And this is because they're either not producing enough tear fluid, or the tear fluid is being directed away from the cornea, or drying up too fast due to an increased disability of the glands that provide the oil into the fluid to keep it on the cornea a little longer.
Is there a way to prevent that from happening?
No.
Oh.
No, it will happen for one of the reasons I mentioned, but
Okay.
there is treatment for it. There is management for it.
Okay.
And depending on which one it is, there are different managements. It is not a disabling disease, but certainly an uncomfortable one.
Okay.
And people who suffer from dry eye, they're really unhappy. Their eyes are always feeling like there's something in there, irritated as heck, red as can be. And there is treatment for it. There is management for it. So for that reason, almost all older people should see their doctor to see if they're showing signs of dry eye, or if they actually have dry eye.
Okay. So why is it called dry eye? Is it because you don't have enough fluid?
That's right. It's
Okay.
because the fluid, you don't have enough, or it doesn't stay on
Okay.
the cornea, which is the front of the eye, of course, to keep the tissue moist,
Okay.
and that you get the symptoms of an irritation of the front surface of your eye or the eyelids,
Okay.
and it is not a happy thing to have.
Yeah, is that the opposite of when you have watery eye?
No, as a matter of fact, it may be the same thing.
Maybe the same.
Yeah, watery eye means that the ducts, the canals that drain your tear, let me explain this to you. The tears comes from the gland called the lacrimal gland, and it comes with every blink. As you blink, it blinks a film of water or of fluid over your eye. The glands inside the eyelids will inject into that fluid. I'm doing it simply. I'm trying to,
Okay, thank you.
will inject some oil into that fluid to make it last longer, stay longer on the cornea, the front surface of the eye. And finally, it approaches the inner corner of your eye and drains out into the nose. That's why
you
you're,
have the-
well, that's why you when you cry, your nose also gets wet, and you sniffle.
Yeah.
It's the fluid, it's the tear fluid draining through that canal into your nose that causes that. Now, when that doesn't drain properly, or you don't create enough tear fluid, all right, or you don't create enough oil, the eye will dry, and you will get the symptoms.
Okay, so you said earlier that you can prevent that from happening.
No, you cannot prevent
or you
it.
can maintain it.
Yes, you can manage it.
You can manage it. Okay.
Right.
So that means that at the what do you use for the management of?
The easiest management is to go to any pharmacy and get any ocular lubricating fluid over the counter.
Oh, so you don't have to see a doctor for that?
Not
if-
yet, or you should anyway, because you have to determine which of those areas that I covered that's causing the damage. Now, if there's not enough oil getting into the tear fluid, okay, then you have to clear out those ducts, those little nerve endings called meibomium glands,
Okay.
to make sure that the injection of ointments, of oils into the tear fluid is sufficient. If you're not producing enough water from the lacrimal gland, then there's nothing you can do, but there is a medication called Restasis that if you put it in your eyes, it may enhance your glands to produce more fluid. If it's causing the drainage to be blocked off, then you may have to have a very, very minor surgical procedure, have the tear drain, what's called puncture,
Okay.
actually probed and opened up so that the fluid can get out of your eyes. When those puncta are closed off, and that happens frequently to old people, the tears will come up and over the lower eyelid, and you'll be constantly watering, and you'll think there's too much water in your eye, but actually your eye isn't getting enough.
Wow. So is it possible as you age?
This happens as you age, and it is possible.
Then it's possible. But is it possible for you to have, for people over 65 to still have 20/20 vision?
Absolutely possible.
Oh, okay.
Absolutely.
Because most of the time, as people age, they tend to use
Reading
have-
glasses?
Yes.
Okay, let me explain that to you. It's just an important misconception that most people have. Vision is a product of the physical shape of your eye. It is not a product of disease.
Is it physical?
Your people may or may not need glasses
Okay.
according to whether light entering the pupil, going through the cornea, entering through the pupil, and focusing directly on what they call the macular area of the retina
Okay.
is clear vision. If it focuses on the macula, you will have clear vision. If your eye is too big or too small, the focus will either be in front of the retina or behind it,
Okay.
in which case an eyeglass lens,
Okay.
positive or negative, can correct that. I won't go into the physics of it, but tell you it's easily corrected with eyeglasses.
Okay.
Astigmatism, which everybody heard the word, they don't know what it is, means that the cornea, the front surface of your eye,
Okay.
is not perfectly spherical. It's aspherical, or maybe even elliptical. The amount your cornea grows away from spherical, or your eye gets big or small, depends on what glasses or contact lenses you will get. All right? The aging process will definitely cause a problem in the focusing of your eye. Your eye doesn't work by magic.
Okay.
If you look at something far away and then look something up close, something has got to change in your eye.
Okay.
When we're born with a little lens inside the eye, and it's very fluid. It goes like this in and out. It's inside the eye. And it works very easily and very nicely. As we get older, that little lens inside the eye hardens, sclerosis. The fibers get closer together. The ability to do that depends on how much you can focus from far to near. By the age of 40, most people do not have enough. The term is called accommodation. Accommodation to focus like far to near easily.
Okay.
The older you get, the less accommodation you have. Finally, when you get to the point where you cannot successfully focus your eye from far away to up close, you get what they call a reading addition. A reading addition is a lens that will bring the focus in closer, and it's what they call the bottom part of a bifocal, or a separate glass just for reading. The older you get, the more of a reading addition you will need. At about 65 or 66, you usually have none left.
Wow.
So just about every, almost every human being
Would deplete.
would need
Okay.
a reading glass. There are some exceptions. We'll not go into them. There are very few of those people whose nearsightedness is exactly equal to their reading range, and they will never need a reading glass. They, in fact, would have to lift their glasses up to read. They will not need a bifocal.
Oh, okay. So,
Oh, one thing more I might say.
okay.
Wearing glasses or not wearing glasses does not cause any damage or further damage to your eye. Your eye will not get better if you wear glasses.
Okay.
Your eye will not get worse if you wear glasses.
So what does the glasses?
They merely correct the visual function, the visual refraction, focusing of the eye itself
Okay.
at that particular time. So glasses will correct, in the absence of any disease, the glasses will correct your vision, cure nothing. And by the time a year or so goes by, your eyes may have changed shape and size.
Then you have to go.
Then
back
you have to
again.
go back and get a different prescription for glasses.
Oh, okay.
The glasses have nothing to do with the health of the eye.
Okay. Now, talking about the health of the eye, what role does diet play?
Not too much. Diet, if you are missing some products, some ingredients, you may get a loss of visual function, peripheral vision, central vision. Can cause that. Severe starvation will. But that's the last thing really that's going to happen. The health of the eye really depends on luck more than anything else, or your genetic background
Okay.
more than
So
anything
diet
else.
has nothing to do with the.
Not that it has nothing to do, it has
but
something
the
to do.
minimum.
You need antioxidants, you need, omega-3s and things like that to maintain the health of the eye. But generally we get enough of that in a normal, healthy diet.
I mean, there is this common assumption that the more carrot you eat, the more.
Well, I don't know, did you ever see a rabbit with glasses?
No.
It doesn't make a difference how much carrots you eat,
Oh, okay.
all right?
Okay.
It makes a difference that you eat a wide variety of food
Oh, okay.
to get.
Usually, that is the common assumption that.
It is not, but it's not true,
But it's not true.
okay?
Oh, okay. So I guess one more question. When you go for an eye exam,
Yes.
what
Okay, what can you expect
What
and who
do
should
you-
you go to?
exactly?
Okay, first who you should go to. This is my opinion,
Okay.
and it is a strong opinion, that a person should choose a qualified eye doctor, either an ophthalmologist or an optometrist, mostly in private practice.
Okay. What is the difference, if you can explain?
Well, on these outfits that sell glasses, chains, that kind of thing, their object is a retail business.
Okay.
Their final product is how many glasses they can sell in a day. And I don't know that I would trust them over a private doctor, whether it's an ophthalmologist or an optometrist, to really do the proper exam on my eye. Now, what should a proper exam be? Well, it should be a very definite, very informative case history. Family history. Does anybody have glaucoma? Does anybody have diabetes? Does anybody have high blood pressure? These are the kinds of questions you should have to answer. The next group of questions that you want answered for you is, are my eyes focusing properly? Are they straight, or are they not moving together at the same time?
Will you be able to know that, or someone have to?
No, that's during the test.
Okay, through the test.
Yeah.
Okay.
So your eyes have to be tested for movement,
Okay.
pupillary function, whether your pupils are contracting and dilating properly and
Okay.
together.
Okay.
All right. And you should have a field of vision test
Okay.
to test the actual limits of the side vision and vertical vertical vision of your eyes, up or down. These are very important tests. All right. A family history of disease, as I mentioned before, is a very important thing. With this knowledge, the practitioner, the doctor, should be able to look at his examination toward those activities, toward those diseases in the family, which may be in you as well, be genetically in you as well. So he should do a pressure check of your eye.
Okay.
That's very primary, a pressure check of your eye. Glaucoma is the most important one, and one of the most common of the blinding diseases in our society. The researchers have determined the limits of the pressure of your eye. They know now that a measurement of the pressure of your eye should be between, let's say, I'll give the numbers and explain it later,
Okay.
should be, let's say, between 8 and 22. Inside of that area of pressure, you don't really have to worry about glaucoma, although another test will actually show that again. If your pressure is higher, at 20 to 24, let's say, then you should be investigated. That's a risk factor. You should be retested for glaucoma itself.
Okay.
All right? And this is done by other tests, field of vision tests, and measurement of the actual nerve fibers inside the eye, whether they're doing their job or they're not doing their job. And then a determination will be made whether or not you need help. Now, glaucoma can be managed like diabetes.
Well, you have to do surgery for that.
Well, not all the time.
Oh, okay.
Okay?
At
Although,
what stage
well,
do surgery?
that depends on the practitioner, what the practitioner decides to do. In the United States, most of the practitioners, before they do a surgical procedure, will do a medical procedure, in which you take a medication that you drop in your eye, and that is designed to lower the eye pressure itself.
Okay.
And these could be prostaglandins, which is a Travatan, Salatin, there's a million of them, that you put in your eyes once in each eye before bedtime, and that will lower
The pressure.
the pressure. If that doesn't lower enough, there are other medications they can add to that, which you may have to put in your eye twice a day.
Okay.
Cosap, Trusap, those kind of medications. All right. There is another treatment. There is a treatment called SLT, selective laser trabeculotomy. And this is where they use a laser to open up the channel that drains the eye,
Okay.
to clear it. And it can be done several times. And that, in conjunction with the medicine, will manage the glaucoma very, very well for most people. So early diagnosis and treatment of glaucoma will preserve your vision. Because the final vision is what they call endpoint glaucoma, untreated glaucoma, or glaucoma that doesn't respond to treatment, to go blind. You actually lose your vision.
Diabetes is a risk.
Yes, it is. The family history of diabetes, and you should be tested, or everybody should be tested. The blood sugar level of the ANC should be tested at least once a year. All right? If you have a family history of diabetes, I would do it twice a year. All right? Because diabetes will affect the small blood vessels in the eye, among other things,
Yeah.
and cause them to break and leak blood, which damages the retina, or exudates areas of collagen on the retina of the eye, which also can cause eye damage inside the eye. Not responsible for eyeglasses or anything like that, but they have to be managed by reducing the blood sugar level of the patient. In diabetes, what one could look for is a quick change of prescription. If you have one prescription, then you go back again, you're not seeing one, you go back again, and there's a change in your prescription, you're a risk factor for diabetes. Although diabetes can easily be tested in any doctor's office, just a mere blood test, a blood drop test, or urinalysis will do, and you'll know you have diabetes. At that point, you should have a retinal examination. The pupils should be dilated with a chemical. This is very long and very complicated. Dilating the pupil gives you a chance to look into the eye and a much wider range of vision. There are also instruments which you can look into the eye with and will direct your gaze in different areas, right, left, up, and down.
Oh, okay.
So that you can see if there's any damage to the peripheral area of your retina.
So this is a comprehensive...
A diabetic examination. Actually, a retinal exam is, at least a primary retinal exam should be done to everybody.
Okay.
All right?
But most particularly to people...
Almost always to older people, because
people,
the older you get, if you have diabetes, it takes a while for it to affect your eyes.
Yeah.
Whatever you get, when you get older, it gets worse. That's one thing you don't have to worry about. Your diseases will get worse.
Oh.
So you have to take care of yourself. There's nobody else going to do this for you.
Yeah.
And you've got to do it properly at the proper doctor's office. So you ask your doctor, do you do these tests? Do you test for glaucoma? Do you test for diabetic retinopathy? Do you test for hypertensive retinopathy? Do you test for renal? These are the things that could be done, or should be done. Besides the vision test for eyeglasses. The vision test for eyeglasses is probably the least important of all the tests, because a bad eyesight will not affect the health of your eye. Bad eyesight, simply that you see blurry, can be fixed with glasses, contact lenses.
I'm sure most of our viewers they've gained a lot from the information that you have, provided. But what can they do, to prolong
Their vision,
the vision?
eat properly.
Eat properly. So that's nutrition is
Nutrition, very
very
important.
important.
Get enough antioxidants, get enough prostaglandins. All of that is very important.
Okay.
There's formulas out by the different pharmaceutical companies. Read them carefully, and if they contain what they call the ARADs, that's the only one that's really been tested to help control macular degeneration.
Okay.
I said control, not cure.
Not cure.
All right? Then they should get a supplement with the ARADs formula in it. There are many out there.
So there is still a level of control that the
No,
FDA
very little control, unfortunately. They're an aid, they help, they don't,
Oh, okay.
Okay, I wish they did more than they do, but except for what they call intravitreal injections of a chemical, they really not like 100%, not even 80, not even 50%, but they will help
So
prolong and manage the condition itself. And we're talking about macular degeneration here.
Oh, okay.
Macular degeneration is where the macula, which is the most sensitive part of the retina, is either bleeding into it, which destroys the macula, or a dry, damaging, what they call dry macular degeneration. No bleeding, but the macula becomes reduced or diminished because the roots of it are being slowly injured. Okay, now everybody, if they live long enough, will get macular degeneration.
How is the condition of your eyes, if I may say, if I may ask?
My eyes?
Yes.
Not good.
Oh.
I have both macular degeneration and glaucoma, which I am treating glaucoma with the proper drops, and it's perfect. The macular degeneration, luckily I have it only one eye, but it is progressing. Not in any way preventing me from living a normal life, but it is. But I do all the food supplements that will help it take longer to do its damage.
Oh, okay. So there is good news.
I wish there were better news, but that's what the news is.
Yeah, I'm sure, with, science, technology, research, things will get
Well,
better.
and the other thing for old people that you didn't mention is cataract.
Now, let's talk about cataract.
Okay, let's talk about cataract. Cataracts, we all will get if we live long enough. And cataracts are caused by, remember I was speaking about the lens in our eye which focuses light for us, and so let's see from far to near. Well, as that lens inside of our eye hardens, sclerosis.
Is it the lens that you can see?
Well, you can't see it.
You can't see
no.
it? Okay.
But it's directly behind the pupil,
Okay, behind the black.
behind the iris and pupil. Right?
Okay.
The black is a hole.
Okay.
The black is your iris, the
Okay.
colored part of your eye. Brown.
Brown.
Okay. In any case, that lens gets harder and harder and harder as we age. When it scleroses enough, hardens enough that the fibers in that lens get so compacted that they either discolor or light can't pass through them, that is cataract. Easily treated. They have surgery these days.
Is it the same thing as discoloration?
Yes.
Okay, of the eye.
Yeah,
Okay.
most people think it's on the outside or it's the shaft. No,
It's
it's inside the eye,
inside the
and
eye.
it's the lens discoloring,
Okay.
flattening,
Okay.
that causes that. Now, when that happens in the United States today, the treatment is very, very effective. I would say 99.9% effective. They can reach into your eye with a fiber optic, a very small incision, open up the little epithelial, little capsule that your lens is actually encased in, make a little hole in that, suck the old hard nucleus out with a little vacuum cleaner,
Okay.
and reinsert a brand new artificial lens into that space, and your eye will be able to see normally again.
Oh, okay.
So cataract is not a disaster. It's a procedure that takes about 15 minutes an eye. You don't even have to go into a hospital, although you may, but you don't have to. Many doctors have this as an outpatient service and an outpatient surgical unit, and they can do it on the spot.
Is it covered by insurance?
Yes, this is covered by insurance. Every of the eye diseases I mentioned,
Okay.
other than the need for glasses. By the way, need for glasses is called ametropia, okay? Ametropia. And other than that, it will be covered by insurance.
Which is
Macular degeneration,
Medicare.
Medicare, Medicaid,
Medicaid,
or most
the
insurance
private
company.
insurance, okay.
Covered completely, all, whatever the insurance covers, 80%, whatever it is, and the supplemental will cover, secondary will cover the rest. Or in case of private insurance, they will have it there. So cataracts, macular degeneration, diabetic retinopathy, hypertensive retinopathy, renal retinopathy, all right, or dry eye syndrome
Okay.
are covered under the medical part of your policy.
Okay.
They're almost totally covered and followed by your insurance, and follow up, will be covered by your insurance.
And regular insurance examination that you advise every year? that
If
is
you
good
get
to-
these tests, they will cover it.
Okay.
If you want these tests and you have the proper symptoms or what the doctor considers proper symptoms or risk factors, you will do the exams.
Okay.
In most cases, I think the practitioner should do those exams.
Okay. But you have to go to the practitioner in order for the examination.
Yes,
to
and
be
the
recommended.
examination should also include a medical aspect, which will be covered. The eyeglass part or contact lens part is not medical.
Okay.
As I explained before, it is not medical.
So that.
It is the normal function of the growth and development of your eye.
Now, talking about glasses and contact lenses,
Okay.
which is most preferable for the older person, or it doesn't matter?
Well, it wouldn't matter.
Okay.
If you don't need surgery, you don't need medicine, you're always better off.
Okay.
If glasses correct your vision, that's all you really need.
Okay.
Now remember, The need for eyeglasses or contact lenses is not a medical problem.
Okay.
It's a genetic problem. It has to do with the growth of the eye itself.
Okay.
Its growth, shape, and size. Okay?
Okay. Thank you so much. Dr. Namosov will be back. And if you have any questions, please do not hesitate to get in touch with us. And we'll be able to answer any of your questions at a later time. Thank you for viewing.